Welcome back. You're still tuned in to News and Views with myself, Salailo Makwidiri. We have officially kickstarted the show, and we're going to be doing that with a very, very interesting conversation. We'll be speaking to MSF, Doctors Without Borders, Mr. Melusi Mabhena, who's going to be giving us more insight on an interesting turn of events out in Gaza, where there's essentially a move by Israeli authorities to kick out Doctors Without Borders out of the country and make sure that they don't continue doing the incredible work that they've been doing when it comes to assisting those that have been affected by a genocide which started right after October the 7th. And Mr. Melusi Mabhena is the Deputy Executive Director of MSF Southern Africa and he's joining us via StreamYard. Mr. Mabhena, thank you so much for joining us and giving us your time. Good morning.
Good morning. Ramadan Mubarak to all the listeners.
Thank you so much. Thank you so much. And I think, we'll jump right into it, Mr. Mabhena. If you can just give insight to our listeners on just the scale of the work that Doctors Without Borders has been doing in Gaza since October the 7th, and just how entrenched is your organization within Gaza in itself, and some of the staff that you have in that part of the world.
Thank you for this question. As Doctors Without Borders, we have been in Gaza since around 1988, but getting to your question specifically, post October 7, we have been running medical operations, which include providing emergency trauma and rehabilitation care, pediatric care, also providing sexual reproductive health. So this has seen us also venturing into even the provision of basic requirements such as water, just to ensure that even the listeners have a good understanding of the volume of the work that we have been doing. Just looking at 2025, for instance, using it as an example, Doctors Without Borders delivered 1 for every 3 children that were born in Gaza. We managed 1 in 5 hospital beds. And in terms of the OPD consultations that we made, we were averaging around 75,000 consultations a month. But getting into 2026 now in January, that number has shot up to over 83,000. So that's the volume of the work that we continue to do. And we have indeed been calling out to say the care is not adequate. We're calling on for more people to come and help us meet the humanitarian needs that we are seeing in Gaza.
Let's talk about the situation on the ground in Gaza and what you guys have been gathering from your staff, the working conditions, having to deal with Israeli authorities who essentially want a monopoly. They want a control of what comes in and out of Gaza, who gets to work, who gets to receive aid and how much of aid. Just the circumstances working in Gaza post October the 7th, the reality on the ground coming from your staff. How's that been like?
It hasn't been an easy environment, I will say, to work in. You would also appreciate, maybe for you as a journalist, you know that international journalists are not allowed in Gaza. It hasn't been easy also for us as a healthcare organization. You'll see this in that healthcare facilities have not been spared. We've always wanted to have a space where people needing medical care could be able to come in and safely receive. Also, since October 7, we have lost over 1,400 healthcare workers in Gaza. For MSF, it's been 15 staff members that we have lost in this genocide. So it's firstly, from a safety perspective, it hasn't been safe for our teams. Secondly, you also see a lot of disinformation that comes sometimes targeted at Doctors Without Borders, sometimes also targeting even our own staff. So it hasn't really been an easy environment, I would say.
I think it was sometime early in February where there was essentially an order that was, released by Israeli authorities regarding Doctors Without Borders and the operations that you guys have in Gaza. Can you give us more insight on that? The fact that Israeli authorities want MSF out of the country. What led to this decision from your point of view? Is there any way that it can be mitigated?
Yes, it's you quite right that since end of December last year, Doctors Without Borders and 36 other NGOs have been asked to leave Gaza. So we think this is mainly because the Israeli government wants to control access to care, which is in essence contrary to what the ICJ decreed, which is also against the international humanitarian laws. Because in a place like Gaza, we will need free access to care to people that are stuck and trapped and in dire situations. So then the Israeli government put in an impossible choice that they placed on organizations like MSF. They were requiring us to give them a full list of our staff, which
Mm,
we were not comfortable to do because for starters, like I mentioned, we have already lost 15 staff in a context where over 1,008 workers have been killed. So we were raising these concerns to say, how can we keep our staff safe if we are to give such a list? So we tried to negotiate and try and find a common ground, which has not been possible up to the 1st of March, which was yesterday, when we are expected to be leaving. But we're trying our best with these constraints because we have an understanding with the Palestinian government to
mhm,
continue to provide care. But we understand this is going to be very difficult with a lot of uncertainties because also from the beginning of the year, we have not been able to get visas to send in our healthcare workers to support. We have also been having challenges, as it were, to ensure that we get our medical supplies in the country. So while we still want to be there for as long as is possible, we are already seeing quite a huge number of uncertainties.
Very, very unfortunate turn of events. Mr. Melusi, I want us to take a quick break. When we come back, I want to touch on whether or not there have been engagements with the Israeli authorities up to this point, and if they've yielded any kind of way forward, any kind of, solutions to this, because it would be a rather unfortunate, event if MSF would be kicked out of Gaza, considering the amount of good work that you guys have been doing. But we'll touch on that after the short break.
Thank you.
For the first time, I can dream again.
The African Muslim company this Ramadan.
Welcome back. You're still tuned in to News and Views with myself, Salayo Makwidi. The time is 19 minutes past 8 Central African time. And if you just joined us, we're still in conversation with Mr. Melusi Mabhena. He's Doctors Without Borders Deputy Executive Director here in Southern Africa. And we're talking about a really concerning state of events. If you just joined us, Israel says it will terminate the humanitarian operations in Gaza of Doctors Without Borders, which is apparently this happened after Doctors Without Borders failed to provide a list of its Palestinian staff, which can ultimately further deprive the people of Palestine, in the besieged areas in Palestine, of life-saving assistance. Mr. Mabhena, thank you so much for staying with us. Before we went on that short break, I wanted to chat briefly about some of the engagements Doctors Without Borders has had with the authorities in Israel, because the last time I checked, I think there was an order which I think gave Doctors Without Borders some leeway. It gave the organization some time to continue working in Gaza. I think it was by the Israeli Supreme Court, if I'm not wrong. They issued an injunction to have you guys continue working in Gaza, to allow 8 groups to continue working in Gaza for now. Has there been any kind of engagement since then? How long will this injunction last for? And is there work, behind, the curtains that will make sure that Doctors Without Borders and other humanitarian organizations continue to stay in Gaza and continue doing the much needed work that you guys have been doing thus far?
Thank you, Salailo, for this important question. The truth, and in all honesty, we have remained open for dialogue with the Israeli authorities. We are hoping to have access. In actual fact, we have an understanding with the Palestinian government that allows us to work. So it's only the concerns that we have we are unable to bring in supplies. We are unable to bring in our international mobile staff that can come in and support the over 1,600 colleagues that we have, Palestinian colleagues, that are providing the much needed humanitarian aid care under the MSF banner. So for us as Doctors Without Borders, we are still very much interested in staying in Gaza for as long as is possible. So we also call upon the international community to use all leverage that they could have, also to try and get the Israeli authorities not to restrict access to care, not to restrict the humanitarian aid that is needed to address the needs in Gaza. So we're calling on everyone to say, let's come in, let's put pressure on the Israeli government to ensure that MSF and 37 other NGOs can continue to provide the care that is needed.
Mm-hmm. I want to come back to that staff list that the Israeli authorities have been asking for. They're stating that is for security reasons, as you mentioned. How common is this practice? We know that Doctors Without Borders works all across the world in different areas. You have a huge presence here on the African continent. The requiring of lists of staff, how common is it? Is it a common practice that happens everywhere that you guys operate, or you've never encountered something like this before?
In principle, where we differed with the Israeli authorities, we raised some safety concerns for our staff. Right? Mm-hmm. We had already seen the media disc campaign that was targeted at MSF, sponsored even in Google ads. So we were coming from a position of concern to say, with this information that they are requiring, what safety measures have been put up to ensure that our colleagues would remain safe. Remember, over 1,408 workers have been killed since October 7. 15 of those had been our colleagues in Doctors Without Borders. So we had these concerns. So that's why we had the hesitation of sharing the list without the guarantees that the staff in concern are going to be kept safe at all the times. It's if it wasn't for the safety of staff and the lack of these guarantees, it would not have been an issue to share the list of staff.
No, most definitely. And I think that makes absolute sense. There's been a number of other aid organizations, it's not just Doctors Without Borders, who are also facing similar kind of restrictions and challenges when it comes to operating in Gaza. What would be a stake if dozens of NGOs that have been working in Gaza for a very, very long time now, and the population of Gaza is very, very dependent on their presence there, if everyone would just leave, if everyone would just be barred from working in Gaza, knowing and understanding the needs that are present in Gaza at this current moment, the long-term implications if Doctors Without Borders and other similar organizations would be kicked out of the country?
Yeah, it just worsens the situation, in my opinion. Like I mentioned, to say last year as Doctors Without Borders, we were seeing an average of 75,000 patients in a month. In January this year, that number rose up to 83,000. So you can imagine the volume of needs. We are actually calling and hoping that come 2026, we are even scaling up our response. We had increased our budgets by a little over 130 million euros, such that we should be able to meet the needs of people in Gaza. But when this care, which we were already saying since October 7, that it's inadequate, when we were calling for more actors to come in, when it's taken out, you can't imagine how it's going to be for the people of Gaza. When you take the MSFs, which were delivering 1 in 3 children. So when you take that out, when you take the capacity of having hospital beds, it's just going to be a dire situation for the people of Gaza. That's why we are calling for the international community to continue to put pressure to the Israeli authorities such that we can guarantee access to humanitarian aid care for the people of Gaza, West Bank, and the occupied Palestinian territories.
No, most definitely. Mr. Mabhena, I'd just like to segue a little bit before I let you go. There's been a lot of challenges, especially in, humanitarian work kind of space when it comes to funding, especially with the United States and the leadership that is there at this current moment, with a lot of funding being pulled out. As an organization, MSF, how have you been dealing with this new turn of events, and how much do you need the public at this current moment? How much do you need the people of South Africa, the people listening from all across the world, to contribute as much as they can to an organization like yours and others that are doing similar work to the ones that you're doing, considering that things are not the same anymore, and the need, I suppose, keeps getting wider and wider, looking at what's happening in the Middle East currently as we speak, with the instability in that part of the world?
Salaelo, you're quite right that we still need so much support from the people in South Africa. We still need so much support from people from beyond. We start to see significant changes in the humanitarian spaces since beginning of 2025, where aid was drastically cut, leaving the vulnerable people even quite more vulnerable. Because if you look at the amounts of money that were taken out, and you're like, wow, how do people survive without this much needed aid fund? Luckily for MSF, we have been able to continue to engage with our donors that we have in South Africa, that we have in Africa, that we have worldwide, to continue to portray and show them the needs that still remain. So we are still calling on these donors to say, without your support, we will not be able to render the much needed care. So even as I mentioned in the case of Gaza, where we still are hoping to stay there for as long as is possible, basing this on our agreement with the Palestinian government and calling on the international community to put pressure to ensure that with the support that we are getting from as far as South Africa, we are able to deliver the needed medical supplies. We are able to deliver water into Gaza. You can imagine it's Iftar, and people need water. There is no water. The taps are dry. So as MSF, we are saying with the support that we get from our donors, from the people that enable us to provide independent humanitarian aid care, we are soliciting for this. It's even more critical, as you mentioned, Salayelo, that funding for most organizations was cut and has been dropped. So for us to continue to be in places like Gaza, we are counting on the listeners to give us the much needed runs.
No, most definitely, Mr. Melusi Mabhena, Deputy Executive Director, MSF Southern Africa. Thank you so much for chatting to us. This is a story that we'll continue following quite closely here at Salam Media, and I hope we share again soon.
Thank you. Thank you very much. It's been a pleasure, and good day to you and the listeners.
There you go. And with that, we've come to the end of that conversation. We're going to take a quick break. When we come back, we'll be having our hashtag Africa Focus feature. This is a part of a show where we look at some of the biggest stories on the African continent. And this time around, we'll be focusing on Kenya. More on that after this.